Hey everybody, it's Mike Ricciuto with Physical Therapy Now. I had a patient who came in who is in her 50s, very active person. We have a lot of very active people who just have pain, or maybe they have mobility problems, maybe they're just not feeling well. The majority of our patients are very active people or trying to get into activity, and that's a good thing because we all know that exercise and mobility is the number one thing to have throughout your life. Anyway, she was coming in. She was very frustrated. Late in her 50s, she had pain down her legs, and she had diagnostic treatment. She had an MRI, she also had an X-ray, and these things were negative. So she was asking where her pain was coming from. And if anybody knows, clinicians know, people in, the medical field will know that there's pain sources that are away from where the pain source actually comes from. We call that referred pain. Now, in the lumbar spine, I always call the pelvis and the lumbar spine the Bermuda Triangle. The reason for this is because there's lots of pain areas that are generated that produce symptoms that are the same, even though it's a different problem. These areas here are the lumbar spine, which, we kind of have seen this long thing here. The sacroiliac joints in the hips and even the knees can all refer pain to every region. So we have people who have sacroiliac problems that maybe had an X-ray for the lumbar spine, maybe it didn't show anything, but it gets very frustrating. And the reason being is because the source of the pain hasn't been identified. And once that has been, diagnosed, then things get a little bit easier. That's what we do here. If you're someone who's suffering from pain, comment pain below, and comment below, and we can answer some questions about your pain that you may be having. If it is pelvis versus lumbar spine versus hip sacroiliac problems, and then there are a host of other problems, especially in females, that have nothing to do with any of these conditions as well. So if you would like to have a conversation about this, type pain in the bottom of this post, and we can talk about your specific pain. And I hope that you learned something here. Thanks a lot. Mike Ricciuto with Physical Therapy Now.